Anne-Marie, thank you. If a family member or loved one is going through chemotherapy, how can you best support them? It's a question we're looking at this morning, exploring everything from providing emotional support, helping manage side effects, and really keeping their environment as safe as possible. Joining us this morning is Nurse Jake. Good morning.
Good morning.
Nice to see you.
Good to see you too.
So it is important to remember that no two patients are alike, but generally speaking, what areas can caregivers pay attention to the most?
Yeah, so as you mentioned, everyone's cancer journey is going to be different, but there's some common elements for caregivers, particularly around the beginning, middle, and end of someone's chemotherapy treatment cycle. So at the beginning, you want to help your loved one or family member with making treatment decisions because, as I'm sure you're aware, it's a lot of information coming at you. It's very complex. So being there as a sounding board and helping them is super important.
So to actually be in that room with the doctor explaining things.
Yeah, when you're hearing that information, oftentimes you're not really hearing it as the person with the diagnosis, so helping them with those decisions. Throughout the middle, making sure you help with making the appointments and attending them. The majority of chemotherapy now is done as an outpatient, so taking them and transporting them to these appointments is going to be really important. And then throughout the process and the middle, you want to help them with those activities of daily living. That's what we call them as healthcare professionals. It's just those everyday tasks like grocery shopping, meal prep, cleaning, bathing. They're going to need help with that. And then, of course, throughout the whole thing is companionship because it can be very lonely and just being there to offer support.
What are some of the common side effects of chemo?
Yeah, chemotherapy can be very complicated depending on your dose, what you're receiving, and the duration, but there are some common ones. So I'm going to talk about 5. So the first one's fatigue. So when you're receiving chemotherapy, it's going into your body, it's attacking those rapidly dividing cancer cells, and it's really tough. And oftentimes it's also killing your healthy tissue. So your body has to put in a lot of effort after, so you're really tired. You're also going to experience nausea and vomiting, but there's a lot of medications now that can help with this, also medical marijuana. And then hair loss. We see that often. It's one of those very common side effects. But one of the ones we don't talk about is mouth sores.
Yeah, what is that? So what are mouth issues?
So our epithelial lining, the cells in our mouths and our throat, are also rapidly dividing, so they're hugely susceptible to chemotherapy treatment. And so you can oftentimes develop sores, you can affect your gums and even your teeth. So it's one side effect that you really want to look out for because it can also put you at risk of infection.
You could take something for that or not really?
Sometimes they'll give you ice chips during treatment, and then there are some gels that you can apply inside your mouth that you can get from your doctor if you experience it. And then the last one,
please tell me the last
which is also important,
Yeah.
is impacts on your mental health. Because we often don't think about this, but there can be a lot of anxiety, stress, and depression.
If you're living with somebody that's going through chemo, what steps should you take around the house?
Yeah, I'm going to talk about one of the biggest things, and that's for a few reasons, and that's the cleanliness of the home, keeping it clean. So first and foremost, you can have a lot of immune issues, so you can be really susceptible to getting sick because it can make your immune system really weak. And so keeping the house clean can help prevent the spread of germs and your loved one getting sick while they're on chemotherapy. The other reason why, Lindsey, is because oftentimes when there's uncertainty or chaos, you want a nice, clean environment at home, and it can offer that sense of control and organization. And then the last reason, and your healthcare team will talk to you about this, is chemotherapy is a cytotoxic agent, so there's toxicity. So that can be released from your body up till 7 days after through your bodily fluids. So doing things like having a dedicated bathroom, closing the lid on the toilet when you flush it, and making sure you're doing laundry in a safe way. And again, your healthcare team will review those precautions with you.
Excuse my coughing,
No,
I apologize.
That's okay. Are you okay?
I'm fine, I'm fine.
I am a nurse.
That's true, you're the right person to be sitting beside. I do want to get to one more thing, and forgive me if I do cough.
Ask me.
Also important to take care of yourself when you're the caregiver.
Yes, research is showing that this is an escalating phenomenon of caregiver burnout. We have an aging population with so many complex comorbidities, so making sure that you're looking after yourself, Lindsey. Making sure that you're eating, exercising, your own supports for your own mental health because it can be draining and a lot of stress as well. And so just making sure you are prioritizing yourself. And if you have any of your own medical issues, don't put them on the back burner. Make sure you're taking care of them.
I got to take care of myself.
Yeah. We can get you a lozenge.
I think so. Thank you.
Yeah.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.